today I will present estimation expenditure allocation for two program, namely anti-cancer program and health surveillance program. There are two category budget, which are operational budget and development budget. Okay, under the operational budget for the anti-cancer program, the government has allocated RM 2 billion 30 million 160,000 338 ringgit. So for that amount, it is distributed by 189,825,900 for emolument. So, for service and supplies, they are amounted about RM 1,272,960 ringgit. So, for the asset, it is 521,950,728 ringgit. And finally, grant and fixed charge, it is amounted to 8 million for 424,000. Next, for the health surveillance program, uh, the government has allocated RM 1 billion 908 million 892,200. This was distributed to 169 million 603,200 for emolument. RM 1 million 168,128 ringgit for service and supplies. And finally, 8,424,000 for grant and fixed charge. The total amount for the operational budget is 2,112,052,538 ringgit. Furthermore, for the development budget, the government allocated about 658 million 470,400 ringgit for anti-cancer program, which include 544 million 860,000 for service and supply, and for asset 63 million 654,000 for the asset. Meanwhile, the health surveillance program has allocation for 3,307,000. This include 1,320,000 for service and supply, and 1,987,000 for asset. The total amount for the development budget is 321,777,400. So I have finished representation the budget allocation. So we will present further about the program. Start with Encik Farhad, which will explain more about program 1.
Program 1 is the anti-cancer program. Okay. So firstly, the anti-cancer program evolves around cancer diseases, as there are so many cancer diseases. Okay. Firstly, we can see that many people around us, we can be self-aware that many people around us has suffered from cancer and has died because of it. Because of that, our first program, which is anti-cancer program, the activities is first one is is an awareness campaign, and the second one is a free or minimum cost checkup. As for the outcomes of this program, it can be seen is to reduce the cancer rate in our community and to increase the awareness of cancer in our community.
Okay. As I repeat it again. What is the anti-cancer program? So, as provided here, activities that being conducted under anti-cancer program is awareness campaign and free or minimum checkups, and the outcome is to reduce cancer rate in Malaysia and also increase the awareness of citizens. So I quite disagree with the cost allocated for anti-cancer program as the expenses is high and it will use a large of budget. This has been proven through the budget allocated by the Ministry of Finance just now, through the operational budget, where the first one, service and supplies for prevention and promotion, will cover almost RM 224 million and 640,000 ringgit for 156 government hospitals, and also for the clinical management is 1,048,100,320,000, which is obviously illogical. Why not the government try to reduce the budget by lowering the spending through the number of government hospitals? Do you really think you can cover all of the government hospitals spending in one time, which is 156 government hospitals? Doesn't all the ministries think that it can probably use a higher budget and exceed the limitation of the budget? Through what? Through machines, medical equipment, chemotherapy, medical terminology, and all of them. So, government, I tell you, I know you are trying to not exceed the limitation of budget, but we don't need to cover all of them in one time, okay? Half of them or lower than the half is will be enough. So, I really hope the government can consider this as the budget allocated is quite high, and by reducing them we can use the money for the another program conducted, which is not going to waste the money and budget for only one program. So that's all from me.
Firstly, regarding the anti-cancer program, I would like to point a certain quote, which is prevention is better than cure. So firstly, regarding the number of hospitals that will be under this program. So as the government, we cannot pick and choose the hospitals that will be involved. This program needs to be throughout the whole country, as everyone in the country can be prone to cancer. We cannot just simply choose which of the parts that we want to focus on. Because of this, it is relevant for the budget to be allocated. Besides that, as for the budget is high, this is because we can see that the anti-cancer program is not a short-term program. The anti-cancer program can be seen as a program that has a long span, which means that the program will provide long-term outcomes, which means this leads to the program will lead to the outcomes will be seen later on. So firstly, why prevention is better than cure? It is not just important for us, the citizens of the country, it is also important for the government. Because as for the citizens, we all of the citizens wants to be healthy, wants to be free of cancer or any other diseases. Because of this, with our anti-cancer campaign, cancer can be detected early and less deaths regarding cancer at the higher stages can be prevented. As for the government, we can see that this will give us the outcome on the return on investment and also value for money, because with the prevention of cancer, the cost later on for treating cancer patients can be lowered, because it can be said that the cost to prevent can be lower than the cost to cure. Besides that, besides from the cost perspective, it can also be seen that we can also prevent death, which is a very positive outcome, because less and less of our citizens of our community will die because of cancer. This will increase our healthcare system to be better if compared to other countries. Last but not least, why our activities under this program is relevant, because it will encourage the citizens to go for checkups. And also, I can say that health can outweigh the cost of anything, the cost of treatment later on. Because of this, it can be said that the anti-cancer program is very relevant, because prevention is better than cure.
Okay, I will proceed with the next program, which is Surveillance Program. Health Surveillance Program is a program where we can monitor citizens' health. The word surveillance is defined as guard or watch, okay? So in other words, surveillance is close observation of people that were exposed to infectious disease to identify any symptoms and immediate isolation. Okay. This program was made generally, but however, the group encouraged is the community of B40s.
For me, this program will consume a huge amount of capital. This is because the program was made generally with no specific target group. However, this program encouraged to the community of B40. So the M40 and T20 will also follow this program. So a lot of budget will be released.
You don't have to worry about that because we will sort this program. We will sort the group only for those who is in need. Okay. And it is mainly for teenagers group, so you don't have to worry about that. Also, why is it teenagers group? Because teenagers will contribute their energy to the economic, political, and social sector, especially in the future.
I'm sorry, but the elderly can also be a leaders. As now, Malaysia is also governed by Ismail Sabri Yaakob. He is 62 years old. And of course, this senior have more experience to govern Malaysia than the younger.
I'm sorry, but I'm talking about in the future. Okay, this country needs needs to have mentally and physically healthy leaders in the future. So we need to have healthy leaders in order to have healthy citizens, because leaders are usually the role model of the people. There will be several activities that will be carried out in order to achieve this program goals. The first activity that will be carried out from this program is health promotion activities. This activity has the potential to increase public knowledge of risks associated with disease. We can hire professionals to speak uh, at the campaign for the attendees about the risks of disease such as obesity, tooth decay, and hypertension, and ways to avoid or lower the risk of any disease.
I understand, but to hire professional to speak to campaign will cost the government because the government needs to pay the professional. The price to pay a professional is expensive, so it will be a waste. So I don't think it will be a good idea. I disagree if this activity is implemented.
Then we will proceed to the next activity, which is require people to make monthly or annually checkups. Uh, as a result, when this happen, we will continue to have healthy citizens. Okay, by doing annual checkup, the rate of fatal disease can be reduced. Also, by attending the campaign talks and so on, we can increase public knowledge about the disease and will make them aware of the risk of contracting any disease. This program can also give benefit towards citizens not only for their health that will be monitored, but also as a result, a healthy generation can also be produced by having this program. That's all from me.
Okay, thank you for all of you. That's all for the budget of two program. I can conclude that these two program is relevant and can be implemented by Ministry of Health.